Welcome to the Spanish faculty. I'm Emma, and today we're diving into something every nurse needs: how to ask about pain in Spanish. If you've ever had a patient clutching their stomach, unable to tell you where it hurts because of the language barrier, this lesson is for you.
And I'm Alex. Trust me, learning just a few Spanish phrases can completely change how you connect with your patients. Ready to feel more confident on your next shift?
By the end of this video, you'll know how to ask, where does it hurt? Describe different types of pain, and reassure Spanish-speaking patients with compassion. Let's get started. All right, let's start super simple. The most basic question you need is, does it hurt? In Spanish, that's ¿le duele? Let me say it again slowly. ¿Le duele?
Wait, can you break that down? What does each word mean?
Good question. Le means you in a formal, respectful way, perfect for patients. Duele means it hurts or does it hurt. So together, ¿le duele? Does it hurt you?
Got it. So I just say, le duele, and they'll understand I'm asking if they're in pain.
Exactly. It's that simple. Now let's practice the pronunciation together. Repeat after me. Le duele.
Le duele.
Perfect. Now the whole question with the upside down question mark feeling. ¿Le duele?
Le duele.
Nice! So that's my go-to phrase when I first approach a patient? Absolutely. But here's something important. You can also make it even more direct by saying, ¿Tiene dolor? Which literally means, do you have pain?
Oh, so tiene dolor is another way to ask the same thing.
Yes. Tiene means you have, and dolor means pain. So tiene dolor equals do you have pain? Both phrases work beautifully, and patients will understand either one.
I like having options. Which one do nurses use more?
Honestly, both are common. Le duele feels a bit more conversational, while tiene dolor sounds slightly more clinical. Use whichever feels natural to you.
Cool. So I've got two tools already. Le duele and tiene dolor.
Now that you can ask if it hurts, the next critical question is where. You need to say, ¿Dónde le duele? That means, where does it hurt you?
Okay, so I recognize le duele from before. What's donde?
Great catch. ¿Dónde means where. So you're literally asking, where does it hurt you? Say it with me. ¿Dónde le duele?
Donde le duele. That flows pretty naturally once you know the parts.
Exactly. And here's the beautiful thing. Patients can just point, and you'll understand. But let's learn some body parts so you can be even more specific.
Yes, please, because if they say something in Spanish, I want to know what they mean.
Perfect. Let's start with common pain areas. La cabeza means the head.
La cabeza. So someone says, me duele la cabeza, they have a headache.
Exactly. Me duele means it hurts me. So me duele la cabeza means my head hurts. You're catching on fast.
What about stomach pain? That's super common.
Great question. El estómago means the stomach. So me duele el estómago means my stomach hurts.
El estómago. Wait, why is it el estómago and la cabeza? What's the difference?
Ah, you noticed. In Spanish, all nouns have a gender, masculine or feminine. El is used for masculine words, la for feminine. It doesn't mean anything about the body part itself, it's just how the language works.
So I just have to memorize which is which?
Pretty much, but don't stress about it. Patients will understand you even if you mix them up. Let's keep going. El pecho means the chest.
El pecho. So that's masculine too.
Yes. And here's another important one. La espalda means the back.
La espalda. Feminine. Got it. Back pain is so common in hospitals.
Definitely. Now let's do extremities. El brazo is the arm, and la pierna is the leg.
El brazo, la pierna. What about hands and feet?
La mano means the hand, and el pie is the foot.
Wait, la mano is feminine even though it ends in O. I thought words ending in O were masculine.
Great observation. Yes, mano is one of the exceptions. Most words ending in O are masculine, but la mano is feminine. Languages love to keep us on our toes, right?
No pun intended with the foot thing?
Maybe a little. All right, one more super important area. El cuello means the neck.
El cuello. So now I can at least understand if a patient points and says, me duele cuello.
Exactly. You're building your nursing Spanish vocabulary beautifully. Let's do a quick practice scenario.
I love practice scenarios. Hit me with one.
Okay, you walk into the room and your patient looks uncomfortable. You want to ask if they're in pain. What do you say?
¿Le duele?
Sí, me duele mucho. What's your next question?
¿Dónde le duele?
Excellent. They point to their stomach. They might say, me duele el estómago. Do you understand that?
Yes, they're saying their stomach hurts. I'd probably document that and check for other symptoms.
Exactly what you should do. See how just 2 questions can open up communication? You're already more effective than before this video.
Honestly, this is already helpful. But what about describing the type of pain? Sometimes it's sharp, sometimes it's dull.
I'm so glad you asked. That's our next section, and it's where you'll really start sounding like a pro. When you assess pain, you need details. Is it sharp, burning, throbbing? Let's learn how to ask. ¿Qué tipo de dolor? Means what type of pain?
¿Qué tipo de dolor? Okay, so ¿qué means what, tipo means type, and dolor is pain again.
Exactly. Now let's learn the common pain descriptors. Dolor agudo means sharp pain.
Dolor agudo. So agudo is sharp.
Yes, think of acute in English, same root word. Now, dolor sordo means dull pain or aching pain.
Dolor sordo. That's good to know because dull pain can indicate something chronic.
Absolutely. Here's another critical one. Dolor punzante means stabbing pain or shooting pain.
Dolor punzante. That sounds like something that needs immediate attention.
Right. And what about burning pain? That's dolor ardiente or dolor quemante.
Dolor ardiente. I can hear the ardent connection, like burning or fiery.
Exactly. You're making great connections. Now, throbbing pain is dolor pulsante or dolor palpitante.
Dolor pulsante. Like a pulse. That makes sense.
Yes, and one more that's super relevant. Dolor constante means constant pain, and dolor intermitente means intermittent pain, or pain that comes and goes.
Dolor constante and dolor intermitente. Those are really close to English words, which helps my memory.
Spanish and English share a lot of Latin roots, so many medical terms will feel familiar. But here's the thing, you don't need to memorize all of these right now.
That's a relief. So what should I focus on?
Focus on being able to recognize these words when patients say them. You can also use gestures and have a pain chart with these terms translated.
Smart. So I might ask, ¿Qué tipo de dolor? And then show them a chart with these options.
Perfect strategy. Combining Spanish phrases with visual aids makes you incredibly effective. You're thinking like a real bilingual nurse now. All right, every nurse knows the pain scale from 1 to 10. In Spanish, you ask, del 1 al 10, ¿cuánto le duele?
Whoa, that's a longer sentence. Can you break it down?
Of course, del 1 al 10 means from 1 to 10. ¿Cuánto le duele means how much does it hurt you?
So altogether, from 1 to 10, how much does it hurt you?
Perfect translation. Let's practice the pronunciation. Del 1 al 10, ¿cuánto le duele?
Del 1 al 10, ¿cuánto le duele? That's going to be so useful on every shift.
It really is. Now, let's quickly review the numbers 1 through 10 in Spanish so you understand their answers.
Yes, because if they say a number, I need to know what it means.
Exactly. Here we go. 1, 2, 3, 4, 5.
1, 2, 3, 4, 5. Okay, those aren't too bad.
Keep going. 6, 7, 8, 9, 10.
6, 7, 8, 9, 10. Okay, so if they say ocho, that's an 8 out of 10. Pretty severe pain.
Exactly. And if they say 10, that's the worst pain possible. Time to act quickly.
What if I don't catch the number they said? Can I ask them to repeat it?
Absolutely. Just say perdón, which means pardon or sorry. They'll repeat it.
Perdón. Simple enough. I like having that safety net.
Let's do another scenario. Your patient is rating their pain. You ask the pain scale question. Go ahead.
Del 1 al 10, ¿cuánto le duele?
Great. The patient responds, ocho. What do you know?
They're at an 8 out of 10. That's significant pain. I need to notify the doctor and possibly give pain medication if ordered.
Perfect assessment. Now you want to ask what type of pain it is. What do you say?
¿Qué tipo de dolor?
Excellent. They respond, dolor punzante. What does that mean?
Stabbing or shooting pain. Combined with an 8 out of 10, I'm thinking this could be serious. Maybe appendicitis, kidney stone, something acute.
You're thinking exactly like a nurse should. See how these Spanish phrases help you gather critical information?
Absolutely. Without knowing these phrases, I'd be totally lost.
Now, let's talk about something equally important, comforting your patients. When someone is in pain, they need reassurance. Let's learn how to say, I'm going to help you.
Yes, I want my patients to know I care, even if we don't speak the same language.
That's the heart of nursing right there. Say this, voy a ayudarle. It means, I'm going to help you.
Voy a ayudarle. What does each word mean?
Voy means I'm going, a means to, and ayudarle means help you. Together, I'm going to help you.
Voy a ayudarle. That's such a powerful phrase. What else can I say?
How about don't worry? That's no se preocupe.
No se preocupe. I'm guessing no means no or don't, and preocupe is related to worry?
Exactly. Preocupar means to worry, so no se preocupe equals don't worry yourself, or just don't worry.
No se preocupe. Simple but so reassuring.
Here's another good one. Está en buenas manos means you're in good hands.
Está en buenas manos. I love that. It's like saying, we've got you. You're safe here.
Exactly that feeling. And one more. Voy a llamar al doctor means I'm going to call the doctor.
Voy a llamar al doctor. So llamar means to call, right?
Yes, llamar is to call. This phrase is super important because sometimes patients just need to know the doctor is coming.
Definitely. Sometimes just knowing help is on the way reduces anxiety, which can even reduce pain perception.
That's so true. Emotional support is part of pain management. You're really understanding the holistic approach here. Let's add another layer. You need to know how long the pain has been happening. The question is, ¿desde cuándo le duele?
Desde cuándo le duele? What does that translate to?
Since when does it hurt you? Or more naturally, how long have you been in pain?
Oh, that's important for assessment. Desde means since, right?
Exactly. Desde means since, and cuándo means when. So you're asking since when?
Desde cuándo le duele? What kind of answers might I get?
They might say desde esta mañana, which means since this morning, or desde ayer, which means since yesterday.
Desde esta mañana, desde ayer. What about if it's been going on for weeks?
They might say desde hace 2 semanas, which means for 2 weeks, or literally since it makes 2 weeks.
Desde hace 2 semanas. That's a bit different grammatically than English, but I get the meaning.
Exactly. You don't need perfect grammar. You need to understand the information. If they've had pain for weeks, that changes your assessment completely.
Right. Acute versus chronic pain requires different approaches.
Let's practice everything together. I'll be the patient, you be the nurse. Ready?
Ready. Okay, I walk into the room and see you look uncomfortable. ¿Le duele?
Sí, me duele mucho.
Le duele mucho. ¿Dónde le duele?
Me duele la espalda.
Okay, back pain. Del 1 al 10, ¿cuánto le duele?
7.
7. 7 out of 10.
That's significant. ¿Qué tipo de dolor?
Dolor constante.
Constant pain in the back at a 7. ¿Desde cuándo le duele?
Desde hace 3 días.
3 days of constant back pain. Now I'd say, voy a ayudarle. Voy a llamar al doctor.
Perfect. You just conducted a complete pain assessment in Spanish. How do you feel?
Honestly, pretty confident. I can't believe how much we've covered and it all flows together.
That's exactly the point. These phrases build on each other, and with practice, they'll become second nature. Let's talk about offering pain relief. You need to say, le voy a dar medicina para el dolor.
Le voy a dar medicina para el dolor. Let me guess, I'm going to give you medicine for the pain.
Perfect translation. Dar means to give, medicina is medicine, and para el dolor means for the pain.
What if I need to ask if they've taken anything for the pain already?
Great question. Ask, ¿ha tomado algo para el dolor? Which means, have you taken anything for the pain?
Ha tomado algo para el dolor. So, ha tomado is have you taken, and algo is something, right?
Exactly. Algo means something or anything. This is important because you need to know what medications they've already had.
Definitely. What about explaining when they'll get the next dose?
You can say, puede tomar más medicina en 4 horas, which means you can take more medicine in 4 hours.
Puede tomar más medicina en 4 horas. So puede means you can, tomar means to take, and más is more.
Perfect. And in 4 horas means in 4 hours. You can change the number as needed. In 2 horas, in 2 hours, in 6 horas, in 6 hours.
This is super practical. What about telling them the medicine will help soon?
Say, la medicina va a ayudar pronto, which means the medicine is going to help soon.
La medicina va a ayudar pronto. Pronto means soon, right?
Yes, pronto means soon or quickly. It's a comforting word to use with patients. Sometimes you need patients to give you more information. A simple phrase is cuénteme más, which means tell me more.
Cuénteme más. That's conversational and inviting.
Exactly. Or you can ask algo más, which means anything else.
Algo más? So I'm checking if there are other symptoms or concerns.
Right. You can also ask ¿tiene otros síntomas? Which means do you have other symptoms?
Tiene otros síntomas. Otros means other, right?
Yes, and síntomas means symptoms. This helps you get a complete picture of what's going on.
This is great because pain rarely exists in isolation. There are usually other symptoms too.
Exactly. Nausea, fever, dizziness, all important to know. Want to learn a few of those terms?
Yes, please. Even just the common ones would help.
Náusea means nausea, fiebre means fever, and mareo means dizziness.
Náusea, fiebre, mareo. Those are really close to English, which helps my memory.
Most medical terms are. That's why healthcare Spanish can be easier than you think once you get started. Let's talk about helping patients get comfortable. Sometimes you need to ask, ¿está cómodo? Which means, are you comfortable?
¿Está cómodo? So cómodo is comfortable.
Yes, and if they're not comfortable, you can ask, ¿cómo puedo ayudarle? Which means, how can I help you?
¿Cómo puedo ayudarle? That's such a caring question. Shows you're there to support them.
Absolutely. You might need to suggest position changes. Vamos a cambiar su posición means let's change your position.
Vamos a cambiar su posición. Cambiar is to change, right?
Yes, you can also say, ¿quiere una almohada? Which means, do you want a pillow?
Quiere una almohada. That's nice for comfort care. What's quiere?
Quiere means do you want or would you like. It's from the verb querer, which means to want.
So I could also ask, ¿quiere agua? For do you want water?
Exactly. You're creating your own phrases now. That's when you know you're really learning. Before we wrap up, let's cover some closing phrases. When you're leaving the room, say regreso pronto, which means I'll be back soon.
Regreso pronto. Regreso means I return or I'll be back.
Exactly. And if they need anything, tell them use el timbre si me necesita, which means use the call button if you need me.
Use el timbre si me necesita. Timbre is the call button, yes?
Yes, timbre literally means bell or buzzer, but in hospitals it refers to the call button. Si me necesita means if you need me.
That's reassuring for patients, knowing they can call for help. What about saying goodbye?
You can simply say hasta luego, which means see you later, or cuídese, which means take care of yourself.
Hasta luego and cuídese. Those feel warm and caring.
They are. Remember, your tone and body language matter just as much as the words. Even if your Spanish isn't perfect, patients will feel your compassion.
That's a good reminder. It's not about being perfect. It's about trying to connect.
Exactly. And the fact that you're making the effort to speak their language shows respect and builds trust instantly. All right, Alex, we've covered so much. Let's do a quick recap of what nurses learned today.
Yes, so we learned how to ask if someone is in pain, le duele or tiene dolor.
Right, and how to ask where it hurts, donde le duele.
We learned body parts like la cabeza, head, el estómago, stomach, la espalda, back, el pecho, chest.
Excellent. And how to use the pain scale, del 1 al 10, cuánto le duele.
We covered types of pain like dolor agudo, sharp, dolor sordo, dull, and dolor punzante, stabbing.
And if you have questions or want us to cover a specific topic, leave a comment below. We read every single one.
Seriously, tell us what you need. We're here to help you succeed in your nursing career.
Remember, learning a new language takes time. Be patient with yourself, celebrate small wins, and keep practicing.
You're already more prepared than you were 20 minutes ago. That's progress.
Thank you so much for learning with us today. I'm Emma.
And I'm Alex.
And we'll see you in the next lesson. Hasta luego! Don't forget to check out our other medical Spanish videos in the description below. Next up, we're covering how to take vital signs in Spanish.
See you again in the next video.